It is Health Diary. Thank you for joining us. My name is Gladys Gachanja, and today we're coming to you from the 4 Points by Sheraton here in Hurlingham. Multiple myeloma is a cancer that affects the bone marrow, and most people do not get a timely diagnosis because it does not necessarily have or show symptoms at the onset. Now, a diagnosis of multiple myeloma is normally attached to a short lifespan, but as you will hear and see today, those who are living with this condition can live on to beat the odds. More on multiple myeloma right after this fact of the matter. Multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Cancerous plasma cells accumulate in the bone marrow and crowd out healthy blood cells. Men are more likely to develop the disease than women, among other risk factors. Multiple myeloma symptoms mimic other conditions, increasing the chances of misdiagnosis. Treatment for multiple myeloma isn't always necessary right after diagnosis.
I'm Jane Wanjiru Mwangi. I started feeling pain on my back. I thought it is just normal, maybe because of the kind of work I do, because I'm a stylist. I work in a salon. So I started taking painkillers. Sometimes in August, I felt like my right leg, like as if it was pulling, was pulling up. I went at the hospital. I was told that I was having arthritis. I took some medicine. Later on, I went back. Now the right leg was not working at all. This was not my color. It was like yellowish, I don't know, like if I had no blood. We stayed like 2 months. I went to Kikuyu. There I was an X-ray. Then the doctor told me that it looks like the right leg is already finished, the hip of the left leg. So I was told to take the MRI. I was admitted at Kenyatta Hospital. So that is where I was done the surgery, and it's where they knew that I had the multiple myeloma. First days I could not walk. I was still on a wheelchair. I was given another drip, and that one was the one which made me at least to walk. After 1 month, I started to go for the chemo, and still I went for the bone marrow test. The hardest thing is now you have to depend with people, because now I'm a hairdresser, I can't work because of the side effect of the medicine. For the first day, I have to receive the one for the drip, and the other one biopsies. I have to be injected on the stomach, which is so near. I have to go on diarrhea. The good thing, I don't use a wheelchair. From when? The second month, I stopped to use the wheelchair. Let's see, now I imagine the Aga Khan to go up to the chemo. It's a distance, but I do walk.
So yes, the conversation is multiple myeloma, and to help us understand this cancer with us is Dr. Anne Mwirigi, who is a consultant hematologist at the Aga Khan University Hospital, and of course Edgar Rodoli, who is a multiple myeloma cancer survivor. Thank you for making time. Dr. We'll start off with you, and we say it is a cancer that forms in a type of white blood cell called a plasma cell. What is this?
Thank you, Gladys. So multiple myeloma is a bone marrow cancer, and it forms from a mature form of a lymphocyte called a plasma cell. The two major types of white cells are neutrophils, which fight, immediate infection, and then the lymphocytes, and they go on to, create antibodies, which protect you against viruses and bacteria and things like that. So Plasma cells are a mature form of lymphocytes, and what happens in multiple myeloma is you have an expansion, an abnormal expansion of the plasma cells within the bone marrow. So normally you should have less than 10% of all your bone marrow cells being plasma cells. But in myeloma, you find that the plasma cells are much higher numbers than that. They might be 15%, they might be 100%. Oh. So there's a wide range. Yeah.
Okay. And to the layman, multiple myeloma and leukemia sound similar. What's the difference?
Yep, they're both bone marrow and blood cancers.
Yeah.
The main difference is the type of cell that the disease stems from. So in leukemia, you have an expansion of the stem cell or the baby cell, whereas in multiple myeloma, you have an expansion of a mature cell, which is a plasma cell.
Okay, so back to multiple myeloma, what causes that cancerous cell or cancerous cells to target the blood cells?
$1,000,000 question. We don't 100% know, but we know there are some associations. It occurs more frequently as you grow older. It seems to occur more frequently in the Black race. Okay, and this is reported in countries where they have, robust registries and epidemiology studies and robust treatment for everybody, and they clearly show that it occurs twice more common in Black people than in Caucasians and also other races. There is a suggestion of some genetic predisposition, and not directly, so it's not directly inherited, but if you have a first-degree relative, that means somebody within your nuclear family with myeloma, then you have a higher chance of getting myeloma than the rest of the population. Other things they talk about are being obese, exposure to chemicals, and cigarette smoking. These are just the generic risk factors for other cancers.
What we would call environmental factors.
Exactly.
And speaking of risk factors, for you, Edgar, clearly you are from Africa, so the Black race, we tick that box. You are male, we tick that box. Genetics, do you have anyone in your family with this condition or any other cancer?
Not that I know of. In fact, I think I'm the first one, the pioneer in our family.
Okay.
Yes.
And she talked about increasing age. How old are you?
I'm 49 at the moment.
And when were you diagnosed?
7 years ago.
So in this case, does this follow your prognosis as you know it, Dr.?
Worldwide epidemiology studies show that myeloma occurs in older people, so that you would say your age would be around 69, 70. But again, in those societies where they've studied the African population, they found that it occurs at a younger age in Africans than, say, in the Caucasians. And in our country, the median age of presentation is about 59 years to 60 years, so about 10 years younger than what is reported in the West. Yeah. So it seems to occur earlier in Black people.
All right, so now you were diagnosed in 2014. What were the symptoms that you were dealing with?
Actually, what took me to the hospital was a backache. I was sent for physiotherapy, but the pain was still there. It was continuously. Then now when they did thorough checking, that's when they discovered I've got multiple myeloma.
How long would you say it took for them to diagnose?
It took about a month. Yes, about a month.
That was pretty quick.
Yes,
okay, Dr. There's some people who say the symptoms sound very similar to other conditions, and at times you can miss multiple myeloma. Is this the case, and what are the symptoms that are very particular to this condition?
Yes, absolutely true. His presentation is very common with bone pain. And as you know, there are so many causes of bone pain, and it requires the physician who is seeing the patient to have a high index of suspicion for suspecting myeloma. Other ways in which it presents, we've had patients who come with bone pain and just feeling tired, feeling unduly tired for your day-to-day activities. And then when you do a blood test, you find out that they are anemic, and that's why they're tired, So anemia is very common. common. Some people present at the point of dialysis. The myeloma has caused kidney failure, and they come for dialysis, and when the tests are done, actually, myeloma has been going on for a while. So there's a whole spectrum of symptoms, but I agree that the symptoms, you know, you need to have a high index of suspicion for myeloma in order to test for it. Because, you know, most of the time people do get sent to physio and things like that. Yeah.
Mm-hmm. At that point, when you were feeling the back pain, as they went through the tests and then diagnosis, did the symptoms perhaps increase with time?
Yes.
What were you experiencing?
A lot of fatigue, tiredness, but mainly it was the bone pain.
Uh-huh. And when you talk about the back pain, did it also manifest in other parts of your body?
Not really, but it was just usually the back area, lower back. Mm-hmm. Yes.
When and what did they decide to do with you after the diagnosis?
They put me on chemo and then treatment, and later on I was referred to India to go do a stem cell transplant.
Uh-huh.
Yes.
How soon after?
It was after about a year. Mm-hmm. Yes.
At the point of diagnosis, what category did they give your multiple myeloma?
They gave me a stage 2.
What is this classification and what does it consider?
The staging of myeloma helps us to stratify patients according to how we expect their prognosis to be. So there are 3 stages, stage 1, 2, and 3, dependent on relatively easy blood tests to do, albeit a bit expensive. So it gives us information upfront to say how aggressive, how advanced is the disease in this patient.
Still on the symptoms, they say at times the symptoms do not manifest?
Yeah, sometimes people are picked up incidentally. I would say that doesn't happen very often in our country, but in our places where people have routine checks, wellness checks, you can pick up an unusual or an unexpected anemia, which then leads to further investigation, or you can pick up like a high protein in a wellness check that leads to further investigation, or renal failure that is unexpected. So some people do come to us in that way. Or sometimes, you know, myeloma, as with other cancers, can cause blood clots, and find this patient actually has myeloma, which probably caused a blood clot.
Uh-huh. So a lot of patients come to you when it is way advanced.
I would say a mix, you know. Yeah, I'd say a mix. Yeah.
Okay.
Yeah.
So when we come back from the break, we talk about the life expectancy for those diagnosed with multiple myeloma. They say it is a short one, but as we can see with Edgar, he is here 7 years later to tell the story. We'll be right back. Welcome back. This is Health Diary, and still with me, Edgar Rodoli, multiple myeloma cancer survivor, and of course, Dr. Anne Mirigi, who is a consultant hematologist at the Aga Khan University Hospital, as we understand more about this condition. And before we went to break, I mentioned that the life expectancy after diagnosis for those with this condition is short, at least theory-wise. When they diagnosed you, did they give you the time frame?
Not in a straightforward manner, but I figured it out from just information. I thought, you know, I had given myself like probably 1-2 years, and everything, I'll have to log off and, you know, everything will come to an end. But I had a very good doctor who told me, no, you shouldn't look at it that way, because he says this disease is diversified in very many ways. You'll even outlive a lot of people. And here I am, 7 years down the line.
I know, and we celebrate you. And at that point when you're Googling, you know, working with Dr. Google to understand the implications of your diagnosis, what's going through your mind when you see 2 years?
Yeah, then I just think, no, I've not achieved everything. And it is scary, yes. But then again, you know, you you digest it and just give yourself the psych that you have to live with it and learn how to live with it and move on with life. You can't live in fear. Once you have the fear, that's when everything starts shutting down.
Okay, Dr. again, back to the classifications and the life expectancy. What informs this?
Multiple myeloma is what we call a heterogeneous condition, so that you have people who will live much, much longer than others, irrespective of everyone receiving the same treatment. And factors that come into that are the ISS staging, where ISS staging 3, stage 3, do worse than stage 1. So there are different things that contribute to a patient's individual risk. What informs the lifespan is a lot of work over the years. My first year in training as a hematologist in 2008, we were just getting the information about the outcomes of the new drugs at the time, which are our first-line treatment now. And they had turned the head on the disease from a disease that people had a lifespan of maybe 2 to 4 years to the updated data from those studies now indicating that about 60% of people who receive the standard first-line treatment are alive at 80 years.
Okay, that's really encouraging. And speaking about treatment, you talked about going through chemotherapy and then being told you can go to India to now undergo this stem cell transplant. What informed this?
When I started doing my chemos in Nairobi, I had a relapse. And then that's when the doctor referred that I go to India to do the stem cell transplant.
And when they were preparing you for the stem cell, did you have to have certain qualifications in terms of your wellness?
Yes, yes, because I remember when I got into India, they put me on, they ran some tests, something to do with my blood and all that. Then, and the sub-medical terms they were using about harvesting my cells, my good cells and bad cells, something like that. And then after that, when they had gathered enough, that's when they put me on the stem cell procedure, which took about, 2 weeks, just locked up in a segregated isolation ward.
The bone marrow transplant, right, is the one that people say is the most ideal to deal with multiple myeloma. Is that the case, and what other options are out there?
Yes, but there is a context for this. So myeloma treatment relies on, first of all, getting your patient into a remission. So typically, myeloma responds to what we call drug combination therapy. So you wouldn't get one drug on its own. And you would give 4 to 6 cycles in periodically reviewing the treatment response. So you would do this treatment for 4 to 6 months with a view of getting the patient into a complete remission, or at the very least into a very good partial remission. And then after that, it is recommended that patients who are in a remission have a stem cell transplant if they're fit enough for it. Our primary treatment is combination chemotherapy, consolidation with a mandatory transplant for the best chance of long-term survival for a myeloma patient. So they have to look at the strength of your heart, to an extent your kidneys, your liver, all your organs, just because of the intensity of the chemotherapy that you get at that time and the side effect profile in those 2 weeks that he has mentioned, in order to make sure you're fit to undergo that. I would also go ahead and say that now, when we don't concentrate so much on chronological age, we have patients even in their 70s, so long as they're fit and healthy, going on to get stem cell transplants.
When you got the bone marrow transplant, did you have any complications?
Oh yes, I did.
Like which ones?
Nausea, hair falling off, and also, diarrhea, and my immunity was very low because it had been wiped out. So, and a lot of weakness. Yes.
And what did you have to do or perhaps change even in your own lifestyle to be able to up your wellness?
First of all, I was told I had to change my diet, and was told especially to stay away from raw food until my immunity started building back. In fact, when I came back to Kenya, I had to go to the baby hospital to be getting my jabs just like a little baby. All of the little, the jabs that babies get, immunization. Yeah, so I had to go and do that all over again.
Are you serious?
Yes, in fact, I used to go to the hospital and they were asking me, where is the baby? I said, I'm the one.
Aha.
Yes.
Dr. explain this.
You get chemotherapy beforehand, which depletes your bone marrow of all its material, all the cells. So you have an empty bone marrow, and then you will have an infusion of stem cells. So in that period, which takes 2 to 4 weeks, that's the immediate period, you're at incredibly high risk of any infection. Even a simple infection that you would normally fight off could end up being life-threatening. You could end up in ICU for that reason. So at the end of a year, when we have dealt with all your post-transplant complications, we need to start your vaccination program like we do for a baby.
At this point, is there a chance that the treatment might not work?
Yes, there is a chance the treatment might not work in 2 ways. One, if for some reason your stem cell harvest is insufficient, so you do not get enough stem cells injected back, you might have a very, very weak bone marrow with low blood counts, okay? So you might not have myeloma, but you might have a weak bone marrow that's not very functional. But then the other way in which it might not work is if the myeloma actually came back, which can happen even after stem cell transplant.
Have you had any relapse since?
Yes, I've had once after the stem cell.
And what was the cause of treatment at that point?
No, after that one, with my doctor, we just went back to the normal chemo, which I'm still taking even up to now.
All right. Now, you said you went to India for this transplant. Why?
Because of the cost, and the stem cell was not available in Kenya.
So, Dr. Ari, are we saying we don't do this procedure in this country?
We don't yet do it in Kenya, no.
The lack of enough oncologists, hematologists also is an impediment to timely diagnosis. When you think about other countries, what's the ideal situation?
Well, it's the same old gambit. We need to train more doctors. We need to also empower, primary care physicians and medical officers out in the counties by providing continuous education through CMEs, because I think awareness is everything. The most unfortunate situation is when you have somebody who presents very late with a malignancy because nobody really recognized the salient features. And additionally, increasing our ability to test at an affordable rate and access to medications also at an affordable rate.
There is now the chemo you're going through. That in itself is very expensive. Do you have any assistance from insurance?
In 2020, that's when the COVID came in and most of us were laid out of work. So it's like NHF knew this, so they told us to pay our premiums 2 years in advance. Little did we know that there was a hidden clause there. They can only give you 6 cycles. After the 6 cycles, you're on your own.
So currently you are on your own?
I'm on my own, high and dry.
Having walked this journey for 7 years, what would you like the stakeholders in the health sector to know?
They should just style up because we're suffering. It's a big burden. I mean, I'm just comparing myself. I consider myself as a middle-class Kenyan, and I'm struggling. I wonder what the other people do.
Dr. Ari, you've been in these shoes for a while, seeing so many patients. Your clarion call?
I'm with Edgar on this. I think health is a human right, and I think we should have a national insurance that actually works for everybody. So I think there's a bit of a lack of cohesiveness. There's a bit of a lack of understanding, and more importantly, overall, I think there should be a responsibility for the nation's health that comes from our leadership. And I think everybody should have access to care.
Very well said, Dr. Anne Mwirigi, who is a consultant hematologist at the Aga Khan University Hospital, and Edgar Rodoli, who is a multiple myeloma cancer survivor. Thank you for your time, and we celebrate you because you encourage others who are also on this journey. At this point, let's take a look at the health tip.
Let's talk about fruits and fruit combination. Here with me, I have a bowl of salad with some neutral fruits, some pawpaw, pineapple, sub-acidic, they're not acidic. Acidic fruits, eat them on their own, and this combination will take 20 to 30 minutes for it to digest. And here, it's our fruit, my watermelon fruit. The reason why I take watermelons alone without combining it with other fruits, because its digestion is very fast. It takes around 10 minutes for it to digest. And here I have my seeds and nuts that you can add in your fruit. And what I can add, these are chia seeds. You can add them on your bowl of fruits. You can just sprinkle. These, they are rich source of proteins and omega-3, and these my cashew nuts, they are neutral. You can just add them in that bowl like that, and it's a perfect combination for your fruits.
Yet another informative episode of the Health Diary. Thank you for joining us. We see you on the social media handles, even as you ask your questions and suggest the conversations you'd like to see on this platform. My name is Gladys Gachanja, and we've been coming to you from the 4 Points by Sheraton here in Hurlingham. Until next time, see you. Tuna record, eh? Okay. It doesn't have symptoms at the onset. You nikikamba manini. Watu wako ito. Hi, let's do this again.
We're done?
Done? Yes, we are. Okay.
Good.